Morning. My name is Dr. Surakshith Battina. I am a fertility expert, an endoscopic surgeon, and a cosmetic gynecologist. I work at Indigo Women's Center in Chennai. This is in Ananagar. And I'd like to thank Divya from the WOW team for giving me the opportunity to come and talk here today to give you guys a brief overview about infertility, what are all the stresses it can cause, and as a healthcare professional like myself, how we can manage these stresses and anxieties of patients. First, how do you define infertility? The definition is 1 year of unprotected intercourse with no pregnancy. If you are below 35 years of age, and if you are above 35 years of age, what happens is that this whole 1 year gets cut down to 6 months. Studies have shown that women with infertility will suffer the same amount of stress as someone with a chronic disease like a heart disease or a renal failure or even cancer. All right, and 10% of couples worldwide in the reproductive age group suffer from infertility. It looks like a small number, but this goes to almost millions and millions. One third of these 10% is because of the male factors, one third is because of the female factors, and one third is because of the combined factors of both the males and females. In developing countries like India, there are a few cultural reasons, and the pressures of conceiving are a lot more than other places. It is expected that in the society, that within 1 year of marriage, the couple should have conceived. And if it doesn't happen, the parents and the in-laws start pushing the couple, and they're like, what, where's the baby? When are you going to conceive? And things like that. So even though a lot of such couples are okay about adopting, some of them would like to adopt, but then even then it is not possible because of the social stigma which is attached to it. And this sometimes make them abandon the idea of adopting any children. So most of them go and seek for treatment in fertility centers. So let's talk a little bit about the psychological stresses what a patient can undergo during this time. Psychological stresses for these patients account to somewhere between the 25 to 60% of the whole population. It is difficult to ascertain this because we don't really ask the patients how you feel. This is not what we always ask. We ask them, we just directly go and do the treatment for them. We just tell them what to do, but we don't ask them how you feel, how you are, what's happening, are you guys okay? So these are questions we need to ask, a little bit more common nowadays. The biggest challenge is always to take the first step. What many people don't understand is that only 5% of the people who are coming in for treatment in any infertility clinic require treatments like an IVF or ICSI. Because we are afraid, because we don't like what we might hear, we are also in denial. We believe that it's going to be okay, let's just move it for a few more months, let's just move it for a few more years. And all of these things inhibit us from getting the right treatment. And this is why most of the time, most of them delay treatment, and sometimes they delay it so long, and it becomes absolutely difficult for them to conceive at a later date. Some of the studies have shown that educated women, okay, seek treatment much later than uneducated women. This might be because of their hectic work lifestyle, or because they're having less time to think about fertility until it's a little too late. And women who are at a higher position at their workplaces, and usually they are in control of all situations, they also find it very, very difficult to cope up with such situations. They think infertility just drains them off completely, and then they feel like a different person altogether when they go in for treatment. I see a lot of doctors bashing the patients and telling them, why you came in so late, you should have come earlier, this is the wrong time. I think all of these kind of negative comments, we should just keep it to a minimum. There is no point in going and digging in the past, but always we say look forward for the treatment, chart out what are the things they have to do from now, and give them goals for the further treatment. Studies have shown that women who have an identified cause of infertility usually are a little bit more depressed than women who are having unexplained infertility. These are just a few studies which have shown that I thought was interesting and you should know. On the other spectrum, there are also some women who believe that unable to bear a child, they are unable to fulfill their goal as a woman. There are another set of women who bring their mothers and mother-in-laws to come for clinic, but the problem is they are under the wrong notion that this is a lady's problem. As I already informed you before, this is one third male issue, one third female issue, and one third couples problem. So usually when they come in with their mother-in-laws and mothers, I say, you know what, you send your mother and mother-in-law back home and bring your husband along. This is absolutely very important, and I only see my patients when they come as a couple. Otherwise, I just say, you know what, I'm not going to give you any treatment. This infertility issue, it's more of like a humbling experience. Most of the time it may make or break a couple. All right, it drains the intimacy from your marriages, it depletes all the emotional resources, it can cause you to lose sight of what even brought you guys together in the first place. All right. Studies have shown that couples who are married for more than 10 years have a much better bonding than the people who are newly married couples. Why is this so? Because once they get comfortable to know each other, they share the experiences. They want to go through, they want to defeat this experience together. Whereas newly married couples, they don't know each other. So what happens in this front is that they still feel, they start doing the blame game. Hey, this is your fault. Or they say, this is no, it's your fault. So these are things that happen in newer married couples, whereas it's not the problem with couples who are married for a longer period of time. Another important thing what you need to understand is communication is key. And it's not only with your partner but with everybody else. Both partners should make enough efforts in communication. And this communication needn't always be nice things you have to talk to everyone. You can also sometimes keep like 1 hour aside where you can talk to the other person and tell them, you know what, these are not the things I like you doing. Hey, I don't appreciate you doing these certain things. So keep that 1 hour during the time of the day where you and your partner can discuss about things that you don't like of each other. Don't keep it throughout the day. 1 hour is more than sufficient. Right, so this way you build a stronger relationship, because being secretive and silent is not really going to be very useful, and it is going to make the treatment even more challenging for both of you. This is the reason why counseling is absolutely essential. Okay, it doesn't matter who you go for treatment. You and the doctor both need the same kind of result. It's not like the doctor is actively trying to make sure you don't conceive, because that's not the reason. And in fact, if you conceive, it's also good for them, because you're going to tell your friends and your family, and everybody knows about this. So you both are actually working towards the same goal. But if the doctor is absolutely not empathetic towards you, they spend more time in looking at the file rather than talking to you. It's always better you find a different doctor, because they are not. It's most likely that this is going to be the way it's going to be throughout your journey with the doctor, and you won't want that. You want the doctor to be communicative with you, try to understand your problem. Only then the treatment actually works. In fact, in my very first consultation, what I do is first I try to understand the couple. This is absolutely very essential. I don't think many people do it. I try to understand the couple. I try to know their body language, where they're coming from. And sometimes I see some couples who are very jittery, and then they are. Maybe I would think that they have already gone through a lot before they came into my clinic. And what I would think is, if I understand that they require some kind of pre-treatment counseling, that is the time I send them to Divya and WW, because she and the team are absolutely phenomenal. So I send them on for the counseling so that they get enough counseling throughout this whole time. If your patients are not counseled about what they're going to go through, and during the journey they actually have a mental breakdown, it is going to be challenging for both the doctor who's treating them and for the family members. So you have seen me mention this a lot of times, saying that, hey, fertility treatment is a journey, because the doctor is your captain and you are the trusty crew members. This journey, why I say it's a journey, is because sometimes the journey is 1 month. For some people, it can be a few years. And there are several times during this journey you might lose faith, you might lose hope, you're broken. But you have to understand that, as I told you, that you and the doctor, we both want the same thing. Studies show that couples who trust their treating doctor more and Dr. Google less are more happier, and they seem to also get results much faster. Information what you get on Google is good information, but there's a lot of garbage information as well. So when both put together, patient is more confused. So usually when doctors have to deal with stress, you have to only deal with a single patient, because they are the ones who are being stressed. But in this situation where there are two people who are involved, you have to treat both of them separately and at the same time together. I'll tell you how. For example, if one partner is more stressed than the other partner, then the one partner's stress actually goes and works on the other one, and both of them get equally stressed. So this happens a lot of times. Also, men and women, they grieve differently. Like, women would like to are more expressive. They would like to cry it out. They would like to show they are angry, whereas men, they just go off for a long drive, or find out how each individual grieves and treat them accordingly. And also, you need to treat them both together. As I said, you have to treat them separately as well as them together as well. I always encourage couples, do some skill based training, which requires two people, and this also improves in the bonding of the couple. uh, Most of the couples during this time will be pushed out of their comfort zone. The first phase of this cultural issue is that what happens is you start blaming yourself. You know what? Hey, I feel guilty. You have a loss of self-esteem, confidence, self-image. All of these are lost because of infertility. Right. The next phase is the anger phase. The couples get angry and frustrated. They're like, why is this happening to me? There are like so many other people around, but why am I the one who's affected from this? You start feeling everything and everyone are against you, and feel that people are being insensitive towards you. And the thing is, actually, in reality, they have always been the same. It's just that you haven't communicated enough to them, so they don't really understand your problem yet. So they are just talking randomly, and all of those random things you think is directed towards you, and that can be a problem. So a lot of relationships will suffer, not only with your partner but also your friends and families. Now, the solution for this is to over communicate and to overcompensate. Okay, so you have to actively tell people, hey, you know what, I don't want your advice at all. Don't tell me what to do. A lot of people, they don't understand. They think that they're doing you a favor. They're like, you know what, hey, at least you're alive. Like it's going to be any consolation for them. They should just inform them, you know what, I don't want your sympathy. Just give me your support. Do inform them that you might be attending a few functions lesser, and they will understand, because you don't want to go to every baby shower. Because you go to the baby shower, you're not going to feel upset about it, and you're going to cry, and you're going to be left alone. So you wouldn't want to go there. And if you inform them and you communicate to them, rather than just not attending, communicate with them and inform them, hey, you know what, I won't be attending your baby shower, and they will be okay with that. And another important thing is, you cannot tell this to everybody. Like, you can't just go randomly tell people, hey, you know what, I'm undergoing this treatment, so stay away from me. Or like, I might act a particular way, don't get offended, and things like that. You can't do this to everyone you meet. So you just tell it to the people you care about the most, because at that in turn stops you from getting hurt. Right. The other kind of stress, which is very unique to infertility, is the hormonal stress. Because during this whole period of fertility treatment, you will be undergoing a lot of hormonal treatments. A lot of hormonal injections will be administered to you, and you will definitely feel a slight change or shift in your behavior until you are on these medications. But find comfort in the fact that, hey, this is only for a very short period of time. These are all transient effects, and the moment you are off these medications, you're going to be absolutely fine. Coming to some of the other stresses, what you can have is a physical stress. You are constantly being probed. Unfortunately, this is the only way we will be able to do this study called as a follicular study. So what is a follicular study? Is basically that we monitor the ovulation of a patient, where we do an ultrasound scan for the patient on alternate days, and make sure and find out when the follicle of the patient has released. That is the day when we ask the patient, hey, you know what, your follicle is released, to you and your husband can be together. Or we do a procedure called as the intrauterine insemination. It only lasts for around 8 or 9 days in the whole cycle. It is not there for a very, very long time. And another important thing I encourage hospitals to do is find an empathetic radiologist. It's always important that the person who's doing the scan empathizes with the patient, and there should be a conversation. You just cannot be silent and do your job and go. If that is the kind of person who you're hiring to do your scans, then there's going to be a lot of awkwardness and a lot of discomfort between the patient and the doctor. So you don't want that situation to happen. So always make sure you hire someone who's a fun, jovial, to do the ultrasound, so that the patients also are happy, and at the same time the treatment also is a success. All right. A second kind of, the fourth kind of stress what a patient can have is called as the financial stress. You are going to have a little bit of financial burden because of infertility treatment. And if you don't get a success, or if you don't conceive in the very first cycle at all, a lot of people get so very upset. They think, what, I've given my everything in this and it did not work. But that is actually not the truth. This is a treatment, it is a journey, it is going to take a while. Don't expect quick fixes, don't expect quick results, because the guy who tells you that hey, what, I'm going to get you 100% pregnancy in the very first attempt, what, they're all sham artists. Please do not go to them and stay a mile away from these doctors. So instead of that, you try to understand this is something which can take time. As I already informed you, it can sometimes be 1 month, it can also be sometimes 1 year. And if I have patients who come to me and ask, doctor, what, I want to be conceived in the very first attempt, I would say, what, I cannot do that. No one can do that. Everything only gives you an opportunity. From We are all at the fertility clinics, we work from somewhere between 30% to 70%. So you see, if you can see, it's a wide range. So you need to give it time so that the range actually works, and then you are able to conceive as early as possible. The most frightening stress what I have found, which patients can have, is called as the 14 days wait. The hell before heaven. So what is a 14-day wait? It is basically that once you finish the whole IVF procedure, IVF is nothing but the in vitro fertilization. We take the sperm outside from the husband, and we take the egg outside. We do the fertilization, and once we complete the fertilization, we put the embryo, that is, we make tiny little babies, and then we take this embryo and push it inside the uterine cavity. We just keep our fingers crossed for the next 14 days and hope the patient becomes pregnant. And this 14-day wait is probably the most difficult time for the patient to handle. I always ask my patients, what, these 14 days, no matter what your result is, go for a vacation after that. So that way they all feel better. Go out shopping, spoil yourself, get enough sleep, watch movies you love, and do things that make you laugh. All right. And some of them have the misconception that they need to lie down on their bed flat the whole 14 days. It's actually not true. In fact, if you do that, that is going to improve your stress level, because you just lying down in the bed in the same place the whole time doing nothing absolutely improves your stress level. So always stay relaxed. Just don't do any strenuous activities. Like, don't go ahead for a run, or you don't go for like pilates or something which is going to be very stressful, but rather do something which is not stressful, and definitely they'll give a positive result for the patients. There are some accessory treatments also which patients have tried, which is like the acupuncture, the meditation therapy, physiotherapy. All of these will help the patients in relieving stress during the infertility treatment. All right. And so finally, at the end of all this, what are my take home messages? The best part of infertility is that there's an end to all this, and you will go home with a baby. There are about 50 to 60 ways of treating infertility, so definitely we will find a way for you. Don't be in denial. Seek treatment as early as possible. Take care of your health and diet. Look for Facebook groups. A lot of important things are actually said on Facebook. In fact, I was surprised to see that there are a lot of support groups on Facebook which is free. There are a lot of people who are on the same journey just like you. So make sure that you find a good Facebook group and you join it. And this only makes you feel not alone when you are undergoing this treatment. Infertility can also put a lot of strains in the couple's sex life. This is also very important. When you start treatment, you really don't care about their sex life, but it's absolutely important they also have a good active sex life, because what happens is, what once they used to consider as something which is fun and procreative, all of a sudden becomes a robotic task. You're like, hey, what, today is the ovulation day, let's go ahead and do it. So that robotic task causes a lot of stress levels. So make sure you know how to separate both of them. right? Have a realistic expectation. Know that it is a journey. I was just telling you about, procreation. Try to understand and separate both of them. Try to separate procreation time and also try to separate infertility treatment time. So that you find a common ground between both of them. A lot of people think, you know what, I'm a man or I'm a woman, I'm not going to cry, this is not what I am. It's okay to cry, it's okay to shout it out, it's okay to just push out all of that anger. It's important that you do that, because that is a way you can actually find relief, and find what is the way you cope up with your grief. All right, many people cope up in their own ways of grief. For example, like, some people grieve, they go and start playing video games. Some people grieve, they go and read a book. So, find out what you can do to cope up with your grief, and I think definitely that will go a long way into helping the couples. So thank you all so much for patient listening. Thank you all so much for tuning in. It means a lot to me. Thanks, Divya, for giving me the opportunity to talk to you today. I think definitely this is something which is going to help a lot of people, help a lot of couples. You can also check me out at YouTube. I also have my own channel at Dr. Surakshith. You can also follow me on Instagram. I'm also at Surakshith. And if you want more information, you can contact us at indigowomencenter@gmail.com. And if you want to get in touch with WOW, 9940221212. All right. So anyway, thank you all so much for listening. I hope you all have a great day, and have a fantastic weekend, guys. Thank you all so much for listening. All right. See you. Bye bye.